good morning. I'm going to talk about summary for general trauma. So the case is a 25 years old boy collision. 25 years old boy has a collision with a scooter with sustained injury over the right leg, and then the pain was in the right leg, is in the middle third of the calf, and then the paramedic arrived at the scene of accident. Safety is yes. PPE yes. The paramedic wore gloves and mask. Responsiveness, the patient is responding. And then airway is intact. Breathing, yes. The movement on chest is seen. Pulse rate is 100. Respiratory is 24 breaths per minute. The patient is having tachycardia. Circulation, the pulse is present. The carotid pulse is palpable. Pulse rate is 100. The skin, they are pale. There's external hemorrhagic seen, second degree hemorrhage. And then the paramedics stop the bleeding with applying pressure onto the femoral artery before the tourniquet is applied. After that, they apply tourniquet and dressing with bandage is put along with adhesive tapes. After that, the paramedic do neurological examination. Pupil dilation is present. Eye opening is 4 point. Verbal response is 5 point. Motor response is 6 point. Lateral weakness is normal. There is no lateral weakness occurs. So total, we have 15 points for Glasgow-Coma skills, which is clear consciousness. According to the head-to-toe examination, the signs of trauma is absent, the bruise is absent, the shape of the skull is normal, the wound of the skull is absent, and skull is intact. While the neck, the sign of the trauma is absent, the bruise is absent, the shape is normal, the wounds are absent, there's no bulging of vein. For the chest, the sign of trauma is absent, the bruise is absent, shape is normal, wounds are absent, there's the sounds, their percussion note and expansions, they are normal, there's no hemorrhagics, there's no hemothorax, there's no pneumothorax. For the abdomen, the signs of trauma is absent, the bruise is absent, the shape is normal, the wounds, they are absent, there's no swelling, sound, percussion notes and expansion is normal. Pelvic, for the pelvic, the signs of trauma is absent, the bruise is absent, shape is normal, the wounds are absent, pelvic is intact. Upper extremities, there's no wound, there's no scars, the pulse is present in both hands, there's no swelling, there's no hyperemia, the temperature is normal, sensitivity is present, active movement in full volume. But as well as the lower extremities, for the left leg, everything is normal. The right leg, there's deforms of right leg, there's open fracture presence on the diaphysis of the right leg, the pulse is absent on the right foot due to the tourniquet, and there's swellings of right leg present, the temperature of right foot is lower than the left leg, and hemorrhage is present at the part of the open fracture before applying the bandage. Capillary refilling time is decreased on the right leg, sensitivity is normal in the both feet, which indicates that the sciatic nerve is not the sciatic nerve is intact. Active movement is decreased in the right leg, and the patients felt pain on the right leg. So the treatment on the scene, the paramedics is giving infusion therapy at the cubital region, normal saline 1 liter in 10 minutes to compress the blood loss. And then they stabilize the spleen of the right leg, giving cold application to reduce swelling and bleeding for 20 minutes. After that, they remove the cold application. They giving IV anesthesia, morphine 5 mg per milliliter, and transfer on a stretcher to the emergency department. Paramedic has arrived to the emergency department of the hospital, and vital signs they will check again. The patient is conscious, the airway is not blocked, respiratory rate is decreased to 22 breaths per minute, pulse rate is 110, blood pressure is 110, Glasgow-Coma scale is 15 according to the score. The fracture of the bone of the right calf will immobilize with the spin. So the patient is having tachycardia, tachypnea, and hypotension. Until the arrival of hospital, subjective examination, social data were taken. The name is Eugene, age is 25, gender is gender is male, address is Katizarenko 26, occupation is student, nationality is Russian, marital status is single, and then the date of administration is 30th of October 2023. Complaint of the patient is general weakness, feeling of fear, and tachycardia. And doctor found there's a fracture with the bandage was seen on the right tibia, on the right calf, and then the patient does not have complaints of pain because the paramedic is given IV morphine. So the history of present disease, the patient is having a collision with the scooter. At the time of injury, the patient noticed there's a sharp pain and crush, and paramedics arrive, stop the blood, and apply the spleen. And then in the ambulance, he was given an anesthesia and antibiotic. For past health history, the patient does not have any gastric ulcer, does not have an allergic, no blood transfusion, no smoking, no alcohol, no drug abuse. Family health history, no diabetes mellitus, there's no any past operations, no tuberculosis, no stroke, no myocardial infarction, no HIV, no hepatitis, no COVID, no hypertension, no hyperlipidemia. There's no medication use, vaccination. The patient is vaccinated with COVID and others basic vaccination like BCG. The patient is vaccinated with tetanus toxoid before, but the doctor will still giving tetanus immunoglobulin and serum for the open fracture. So the conclusion, the patient is having fracture on the right leg. There's no complaint on any other parts of the body, and the emphasis should be given on examinations of any other system in the body, and X-ray is needed to confirm there's the localizations of the fracture and the nature of the damage. Upon general inspection, the vital signs will check again. Respiratory decreased until 20 breath per minute, pulse rate is 100, blood pressure is 110 and 85. General condition is unsatisfactory, is middle grade, and others, they are all normal. So for the conclusions of the general inspection, by comparison of finding of paramedics, the patient's skin color recovered from pale to normal. The skin is moist and turgor also returned to normal, which indicates that there's improvement of conditions of the perfusion. And the pain phase is reduced to the normal phase, indicates the proper functionings of morphine. Further investigations is needed to emphasize on the cardiovascular system and also musculoskeletal system. Fluid and electrolyte test is recommended to monitor the state of perfusion. In the respiratory system, during inspection, palpation, percussion, and auscultation, everything is normal. So the conclusion of respiratory system is the respiratory system is not compromised, and the respiratory rate is back to normal, which is 20 breaths per minute. However, a plain chest X-ray still need to be done for further investigation. For cardiovascular system, upon inspection, palpation, percussion, and auscultation, the cardiovascular system is not compromised. However, there's a sign of hypotension is present and is expected, as well as the peripheral vascular system, except for the right leg, for the local status, the other part is not compromised. So for the gastrointestinal tract system, upon inspection, palpation, auscultation, and percussion, the GIT is not compromised. There's no paretic ileus. In the genital urinary system, according to inspection, palpation, percussion, the genital urinary system is not compromised. All signs are negative. So for the local status, in order of the doctor to examine the conditions of local status, the dressing and bandage they will remove, and then they will examine to the at the area of fracture. So examination result, the exposures of the bone fragment, there's obvious protrusions of the bone fragments under the intact wound. The wound of the skin, yes, they have open fracture wound. The skin color is reddish in color. There's bleeding and bruising. There's swelling on the right side. The temperature is decreased. The sensitivity is normal. The movement, active is not possible. Passive is not possible because it's immobilized by the spleen. Tenderness is yes. Crepitation, yes. There's shortening and lengthening, yes. The right leg is shorter than the left leg. The axis is deviated and the pulse of artery is weak pulse. So the conclusion, the open fracture of the tibia is displaced with the regions of diaphysis. The evidence of the fracture is not dislocated because there's open fracture with the protrusions of the bone fragment, and there's external bleeding and swelling of the extremities. So an leg X-ray is done to identify the types of fracture according to the displacements of the bone fracture and also the fracture line. So for the laboratory and instrumental diagnosis, the laboratory diagnosis, hemoglobin is decreased, platelet count is also decreased. And then for the chemical screen, biochemical blood analysis, the chlorine is increased. For the urine analysis, the color is dark yellow color, clarity is clear, pH is in the normal range, and specific gravity is slightly higher. At the in the instrumental test, the plain chest X-ray, the result is normal. ECG, the result is normal. At the X-ray of the right leg, we can see that there's an open tibial fracture of the right leg, and then the location is diaphysis, and the bone which is involved is tibial bone. The part of the bone is diaphysis. The fracture line is oblique, which there's a displacement of the bone upward and protrude, which the patient is having shortening of the right tibial compared to the left one. So for the conclusion is the patient is having open fracture of the right tibial. That's all for my presentation. Thank you.